Hello, my name is Kristina Dupler. We're here to do the physical exam for Nursing 612 from Maryville University. This is Mr. J. He's volunteered to be our patient today for the exam. Before we had him come in and have a seat on the table, we had him empty his bladder. We took a full set of vital signs, including his blood pressure, pulse, respiratory rate, and temperature. We also measured his height and his weight. We also did a vision test, both with and without his glasses. We tested his distance vision with the Snellen chart, and then we did his near vision with the Rosenbaum chart. First thing we're going to do is just a general inspection, looking for symmetry, any obvious lesions or masses. I'm going to take his glasses just to keep those in safekeeping. I'm going to have, the first thing I'm going to do, again, looking at the symmetry, I'm going to make sure, hopefully that his eyes kind of line up with the top of the auricle of the ears. We're going to go through some quick testing of some of the cranial nerves. I'm going to have him do some exercises with me. The first thing I'm going to have him do is clench your teeth, squeeze your eyes tight shut, wrinkle your forehead, smile, puff out your cheeks, stick out your tongue, and move your tongue side to side. Okay, and that tells me that all those cranial nerves are working or intact. The next thing I'm going to do is I'm going to palpate his scalp and his skull. I'm going to be looking at the hair pattern and line. I'm going to be feeling for any masses, anything unusual there. I'm going to palpate the frontal sinuses and the frontal bones and the maxillary sinuses, feeling for any tenderness. I'm going to feel the temporomandibular joint. I'm going to ask him to open and close his mouth. I'm going to be feeling for any clicking there, and move your jaw side to side for me. Good. Any tenderness at all in there. Next thing I'm going to do is test the sensation on his scalp and his face. If you can close your eyes for me and tell me where I'm touching you.
Left cheek.
Good.
Right cheek. Chin. Left forehead. Right forehead.
Good, and that tells me that the sensation there is all intact. The next thing we're going to do is just an inspection of the eyes. I'm going to look at the sclera themselves, making sure that there's no jaundice or redness of the eyes. I'm going to look at the conjunctiva. Can you look up for me, making sure that those are nice and pink and moist. I'm going to look, we're going to look at the pupillary function of his eyes too, if you can look straight ahead at me. The first thing I'm going to do is look at the direct response of his pupils, and then the indirect response, looking at the other eye, and then again on this side, and the indirect. The next thing we're going to do is do a cover and uncover test. If you can cover one eye, pick a point on the wall, okay, and then uncover. Good, and the other side, and uncover. Good, and I'm looking for any unusual extraocular movements or any nystagmus, which he had none. The next thing we're going to do is look at the cardinal fields of gaze. I'm going to have you follow my pen and keep your head still for me, just with your eyes. Good, and all of those seem to be intact. Again, looking at those cranial nerves. The next thing we're going to do is take a look at his ears. Looking at the size of the ears and the symmetry, we're going to palpate the auricles as well as the pinna, feeling for anything unusual. We're going to test cranial nerve 3 with his hearing in several different ways. The first way we're going to do is the hearing test. I'm going to have him block one side of his ear. I'm going to whisper a word, and he's going to tell me what that is.
Apple.
Good. Block this ear.
Purple.
Good, and he can both hear grossly what I'm whispering to him. The next thing we're going to do is we're going to test his both the bone conduction and the air conduction of his hearing. The first test is the Weber test. I'm going to strike the tuning fork and put that in the center of your skull, and I want you to tell me whether you can hear that in both ears equally or in one ear more than the other.
Equally.
Good. The next one we're going to do is the Renna test. I'm going to strike the tuning fork, put that on the mastoid bone behind the ear. and he's going to tell me when that sound goes away, and then we'll move that tuning fork out to the side of the ear, and he'll tell me when the sound goes away at that point.
Now. Now.
Good, and we're looking for the air conduction to be approximately twice as long as the bone conduction, which would be normal. And we would do that for both ears. The next thing we're going to do is we're going to take a look inside of the ears with our otoscope. I'm going to gently insert the speculum and then pull back. Of course, I would have to turn the light on first, and then pull back. Looking at the tympanic membrane, looking for any cerumen. We want the tympanic membrane to hopefully look normal, nice and pearly gray, without any fluid or erythema there. And we would do that for both sides. And those look normal. Next thing we're going to do is we're going to take a look at the nose, looking for symmetry, whether there's any curvature along the spine of the nose, anything unusual or masses. We're going to test the patency of each nostril. Breathe in and out. Good. And in and out. Next thing we're going to do is have you tip your head up, and we're going to look inside the nose, looking at the septum and the turbinates, making sure our septum's not deviated and that we don't see any big polyps or anything boggy or unusual. You can relax. Next thing we're going to do is take a look at the mouth and the oral pharynx. The first thing we're going to do is just look at the outside. Mr. J has a mustache. We want to look at the hair pattern there, make sure that that's evenly distributed. We're going to look at the mouth, making sure there's not any unusual cracking of the lips or in the corners, and that everything looks healthy there. We're going to have Mr. J open his mouth for us. And the first thing we're going to do is just kind of do a general inspection, looking at both the hard palate and the soft palate, looking at the dentation, making sure that all of his teeth are still intact, if there's any obvious signs of decay. I'm going to look at the sides, at the buckles of his mouth, making sure that those look okay. I'll have him look underneath his tongue. Okay, and then I'll have stick your tongue out for me, and I'll look at the sides, looking for any obvious masses or anything that would concern me. Then I'm going to have him say, ah. I'm going to look in the back of his throat, looking at the uvula, make sure that that's midline, and at the pillars of the tonsils, looking for any exudate or anything unusual in that regard. The next thing we're going to do is take a look at the neck, making sure that everything looks fairly symmetrical and in line. I don't see any obvious jugular venous distension. We're going to do some range of motion of the neck, make sure that everything is intact there. Can you put your chin to your chest for me? And then lean back as far as you can, and in the midline. Then I want you to rotate your head and look over your shoulders, both one side and then the other, and then back in the midline, and then touch your ear to your shoulder. Good. Good. And then we're going to do that and make sure that can you push against my hand? Good. And back. Okay. Then relax. Okay. Then try to turn. Good. And then try to turn. Good. Okay. And know that he can push against me and all those things normal. I'm also going to have him lift his shoulder. Good. For that shoulder shrug, looking at cranial nerve 11. The next thing we're going to do is again take a look at the neck. I'm going to feel the carotid pulses, both on one side and then the other. I'm going to make sure that our trachea is nice and midline. I don't feel any obvious or see any obvious tugging. I'm going to palpate our thyroid gland, or try to. Can you swallow for me? Good. Feeling for any masses or anything unusual there. Next thing I'm going to do is palpate the lymph node chains. We're going to start kind of behind the ears and feel the postauricular, and the preauricular, and the occipital coming around, and the tonsillar, and the submental, and the submandibular. I'm going to feel the supravisional lymph node chain, the posterior lymph nodes, the deep cervicals, supraclaviculars, as well as the infraclaviculars, which I don't feel anything enlarged at all, or anything, any masses are unusual. Next thing I'm going to do is I'm going to listen to the carotid arteries with the bell of my stethoscope. Okay, I want you to take a deep breath in and hold it for me. Good. And let it out. And again on the other side. And listen for any worries. And the last thing I do is just listen, breathe normally to his thyroid, making sure I don't hear any unusual sounds there as well, which I do not. The next thing I'm going to do is just do a general inspection of his arms and his shoulders, looking again at the skin for any lesions, any obvious masses. I'm looking for symmetry. Also looking at the distribution of the hair on his arms and feeling the temperature. Looking at his hands, looking at the nails, making sure I don't see any splitting of the nails, and his capillary refill looks okay. Less than 3 seconds. I don't see any clubbing of the nails either. We're going to check the pulses in his arms, and we're going to check for brachials as well as the radials, making sure that those both feel even and normal. We're going to now have Mr. J turn around and face the back, and we're going to take a look at your back first. Again, we're going to do a general inspection of the back. We would be looking at for any lesions or any obvious bulges or masses. We would kind of gently palpate the back, again, feeling for anything unusual around the CBA area. I would gently palpate those areas as well for any tenderness at all, anything bothering you there. Good. Next thing we'll do is also I'm going to check for tactile thermatus, and when I touch your back, I want you to say the words 99 for me.
99.
Good.
99. 99. 99. 99.
Good. I don't feel anything unusual there. All that seems fairly normal. Next thing I'm going to do is just check for his diaphragmatic excursion. Okay. I want you to take a big breath in and out. And I'm just looking for equal hand movement there, that everything seems very symmetrical. Next thing I'm going to do is percuss the chest. Looking for any areas of dullness that may alert me to any time signs of consolidation or masses. And all that seems fairly normal. We're also going to auscultate the chest, listening for any advantageous breath sounds. Take a deep breath. Good. And again. Sides. And I don't hear any crackles, wheezes, any pleural flexion rubs that would cause me to be concerned. The last thing I may do would be to check the expansion of the diaphragm, and I would do this by measuring. And I'll have Mr. J take a big deep breath in. Okay. Mark that area. Okay. And then just relax and let that breath out. Okay. And I would measure those 2 areas. And typically, that's going to be between 3 and 5 centimeters, and his is at about 4, which would be within the normal range. I'm going to have Mr. J turn around and face back towards the front for me. We're going to do a general inspection of the chest. Again, looking at the chest wall for symmetry, the distribution of the hair pattern on his chest, the way his pectoris muscles lay as well. I'm going to look at his respiratory effort, making sure that that's even and unlabored. I don't see any obvious pulsations on his chest or any heaving. The next thing I'm going to do is check for tactile thermatus on the front as well. Can you say 99 again for me?
99. 99. 99. 99.
Okay, good. And I don't feel anything of that nature. I'm going to check for the apical area of impulse, which typically is going to be in the midclavicular line about the 5th intercostal space. which I can feel. Okay, the next thing we're gonna do is also, we're gonna check underneath his arms for any enlarged axillary nodes. Just relax your arm for me, let me hold on to that. Okay. Now don't feel anything enlarged there at all. Good, just relax your arm down. Next thing we're gonna do is listen and auscultate the front of his chest as well. Take some big breaths in. And again, I'm listening for any unusual or advantageous sounds. I don't hear any wheezing, crackles, or pleural friction lobes. Listen out to the sides as well. And while I'm here, I'm going to go ahead and listen to his heart tones. I'm going to start at the apical area, at the aortic area, and listen on the right side in the second intercostal space. Just have the patient breathe normally. And then I would listen to the pulmonic area, Erb's point, the tricuspid area, and lastly, the mitral area. And again, I'm listening for any unusual sounds or any murmurs. Lastly, I would probably go ahead and percuss the front of the chest, again, listening for any areas that would be unusual or any dullness. And that all feels very normal and sounds very normal. After we do that, we have Mr. Vince kind of Mr. J lay down for me, and we will inspect his abdomen. First thing we're going to do is just kind of do a general inspection and just kind of look at the contour of his abdomen, looking at any scars he may have from previous surgery, as well as any obvious pulsations that may be going on, and look at musculature of his abdomen. After that, we're going to auscultate and listen for bowel sounds in all 4 quadrants. Then after that, we would listen at the arteries at the abdomen, first the aorta, then the renals on both sides, the iliacs, and finally the femoral arteries. And those all sound very normal. Next, I would percuss the abdomen. Okay, I would expect it to be dull over areas of solid organ like the liver. And then either tympanic or hyperresonant over areas of hollow organs. And all that sounds very normal. Next, I would see if I can percuss the borders of the liver. Can you take a deep breath in for me and hold it? Okay. And then I'll mark that area. Okay, relax and blow that out. Mark that area and measure it. And typically that's going to be between 6 and 12 centimeters. And for Mr. J, that's at 7 centimeters, so that would be considered normal. The next thing I'm going to do is just gently palpate the abdomen, feeling for any tenderness, masses, or anything unusual. And I want to move on to deep palpation of the abdomen. Again, for anything unusual. We'll see if I can feel the margins of the liver. Take a big breath in. Blow it out. Okay, again, I'll be feeling for any unusual hardness or irregularity of the liver border. Again, I could try that on the spleen side as well. Take a big breath in and blow it out. And typically, I would not expect to be able to feel the spleen. Okay, you could also try to feel the kidneys. Is there any tenderness or anything unusual? And I don't feel anything there. Okay. The last thing I'm going to do is kind of feel, see if I can feel the midline of the aorta, feel if I feel any unusual aortic pulsations, which I do not. The last thing I'm going to do is take a look at the abdominal muscles. And I could do this in different ways. I could have Mr. Mr. J kind of bend up and do a crunch for me. Good. And back down. Okay. And those all look symmetrical. And look at the, if that didn't tickle him too much, look if there was any unusual movement. While he's laying down, I'm going to go ahead and look at his legs and his feet, looking for, again, symmetry, looking at the skin, anything unusual, any lesions that I would be concerned about, the distribution of the hair. I'm going to look at his feet. I'm going to feel the temperature and note that they are fairly symmetrical and even. I'm going to check the pulses in the popliteals. And I'll come down and check posterior tibialis as well as the dorsalis pedis, and making sure that both of those feel equal and strong in both feet. I would inspect his toes as well, looking in between the toes, making sure I don't see any lesions or anything unusual, as well as the bottoms of his feet. I would test the strength while I'm down here. Mr. J, can you push down like you're pushing on the gas? Good. Pull up with both feet. Good. Lift this leg up for me. Don't let me push it down. Good. Lift this leg up for me. Don't let me push it down. Good. Good. I'll go ahead and have you sit up for me. Okay. And while we're testing strength, I'm going to go ahead and test the strength of his upper arms as well. Can you hold your arms out to the side for me? Good. Don't let me push them down. Good. Don't let me push them up. Good. Put them out in front of you. Okay. Good. Push me away. Good. And pull me in. Good. Both of those feel equally strong. The next thing I'm going to do is test the sensation on his arms and legs to see if he can discern between a sharp and a dull sensation. Can you close your eyes for me? Tell me whether you feel something sharp or dull.
Sharp. Dull. Sharp. 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 Dull. Dull. Sharp.
Okay, good. And he's able to be able to discern that very well. I'm going to test his reflexes. I'm have him relax his arm for me. Okay. First I'm going to test is just the brachials. Okay, and we'll do that on both sides. Okay. Then I would test his knees. Okay. And then I'd also do the Achilles. And just relax your leg for me. Okay. And making sure that those reflexes are all intact. The next thing I'm going to do is I would have Mr. J stand up for me. Okay. Face the wall. Okay. I'm going to look at his C-spine at this point, making sure that this all feels okay and looks symmetrical in line, and that his spine lines up, and that everything sits equally over his hips. I would have you go ahead and bend your chin down. Just chin down, and then all the way down, go ahead and touch your toes. Looking for that spine that looks like it's should be midline without any curvature of the spine, that his hips are resting nice and even. You go ahead and stand up for me. Can you do a squat? And bend down and back up. Good. That tells me that his balance is fairly well intact. And if you can turn and face forward for me, put your feet together, and then close your eyes. And that's our Romberg test, and I'm looking for any excessive swaying. That tells me that his balance is intact. You can go ahead and have a seat for me. And that concludes our physical exam. Thank you very much.